Podcast Bites.
Thousands of neurologists, probably hundreds of thousands of neurologists, were having to deal with their patients coming in saying, what about food? And in 2011, they were saying food didn't matter.
Mm-hmm.
But now that we're getting the basic science down, we understand that food turns genes on and off. Food affects our microbiome. Food affects the cytokine levels. And we have more epidemiologic evidence linking food, diet quality, and disability status, brain volume, and lesion load. Now, more and more of the neurologists are saying, well, yes, food does matter, and the quality of your diet does matter. So it's a very exciting time. And to my colleagues who think this is a very rapid time period. In just 10 years, we've gone from food doesn't matter to the scientists saying food matters a great deal, to the clinicians who are now beginning to agree, yes, food matters a great deal.
And in those clinical trials, it sounds like potentially using food as medicine in science itself, right?
Yes. These are food-based dietary intervention studies. Most of the previous dietary studies were supplement studies, using fish oil, using a particular supplement, green tea extract. Now, finally, and it's much harder to do a food-based study. It's a different kind of science, but I'm very excited to see that is happening. And part of the reason it's happening is that when I wrote my book, The Wahls Protocol, and it became a bestseller, that drove public awareness, interest. It created a lot of momentum, and the National Multiple Sclerosis Society, bless them, because they follow their constituents and what they do in social media. They saw this huge interest and demand and expectation. So they did make dietary research, food-based dietary research, a research priority. And so they funded some of these early pilot studies, which then allowed for investigators like myself to use those pilot studies to write for bigger grants, which now are why there are 13 intervention studies that are registered in the clinicaltrials.gov.
Avocado, motherfucker.